Hi, my name is Nick and I am a physiotherapist with E3 Chiropractic and Wellness. Over the next couple of weeks, we're going to be going through a few different tips as well as exercises for helping to improve and maintain the health and function of our neck. And so today we're going to go through some relevant anatomy to help understand the area a little bit better, as well as some common issues and injuries that can happen to our necks over the years. So when I'm talking about the neck, I'm talking about the area that extends from the base of our skull all the way down to the top of our rib cage. If we take a look at some models, we can kind of see a little bit more about what's going on through there. So the neck itself is made up of 7 small cervical vertebrae. So it's these 7 small bones that start at the base of the skull and extend down the spine. These vertebrae are really cool and really important because they house a few different structures. One of the most important structures in the body, our spinal cord, runs directly through the center of these vertebrae. So that's going to bring nerves all the way down through the rest of our body. These vertebrae also have 2 small holes on either side for the vertebral artery. And so that's the artery that brings blood from our heart all the way up into our brain. So obviously a really important structure as well that is important to be protected as it runs up through the body. On this model here, you can see these small little yellow strands that are coming out through the sides of the vertebrae in between the different vertebrae there. Those are going to be the starts of nerves that are going to help to supply our upper extremity with motor function and sensation. So really, really important structures there as well. Connecting each of the vertebrae, we have a few different joints. So on the back side, on either side of the spinous process, we have what's called facet joints. And so those are little bony joints that help to connect vertebrae to vertebrae. And on the front side, in between each of these big, large vertebral bodies, or the big chunk of the vertebrae, we have a disc. So similar to your low back, same as your mid back, each of these vertebrae have a disc, which allows for a lot of movement as well as some shock absorption as well. So our neck is a really awesome area of the body because it allows for a huge range of motion and a lot of variety of range of motion, all while keeping all of those really, really important structures nice and safe and protected by bone. Our neck is great in that it allows lots of different movements. So one of the movements we can do is flexion. And so that's basically just bringing your chin down towards your chest, looking down. Extension, so bringing that head all the way up, looking up towards the ceiling. Side flexion, so bringing your ear towards your shoulder, and rotation, so looking backwards. And it allows for any combination of those movements kind of all at once as well, all while keeping that really important stuff in our neck safe. Because there's a lot of important structures that run through our neck, when we have injuries to the area, it can often feel quite severe and can result in any number of symptoms. So some common symptoms that people experience when they're having issues with their neck include headaches, dizziness, nausea, pain directly in the muscles or joints of the neck, pain that can sometimes extend down into the arms or up into the head, even into the jaw sometimes. And there's lots of different ways that we can develop issues in that area. A really common way of injuring the neck is through some sort of physical trauma. So that could be a car accident, that could be a sporting injury, that could be a fall onto the shoulder or onto the back where your neck moves really quickly. What happens is that creates tissue damage in the neck. And so some of those structures that we talked about earlier can become damaged and become inflamed. And then because it is a lot of important structures running through a small area, we end up getting more pain and more dysfunction than even just the initial injury at times. Another really common issue with the neck can come from postural issues or from overuse type injuries. And so basically what that is instead of one big force coming onto the neck causing damage, it's really prolonged low level force on the neck that over time starts to cause irritation. And so things like postural abnormalities, really repetitive use of some of our shoulder muscles or some of our neck muscles, or just not really using our muscles in an efficient, proper way. So in the coming weeks, like I said, we're going to go through a few different exercises and a few different movements to make sure that we really are maximizing the health and function of our neck and getting it working really well. And these will be things that you can add into your daily routine or treat as a warm-up at the gym, just little things to kind of add into the mix. If you are experiencing any major symptoms or any severe symptoms of your neck, it's always a great idea to have that assessed by a movement specialist like myself. And we can definitely give you some more specific tips to get you on the road to recovery a little bit faster. Thanks.